Okay, back with another exercise review. I'm looking at him performing a RDL, so a conventional deadlift. The only things that I noticed, I'll go ahead and talk about it as I pull it up on my computer. The move, like his form looked great. I think mostly there was a lot of extension in the neck and extension in the lower lumbar spine during the concentric phase. So like the eccentric phase here would be the lowering phase, and then as he comes up, he had a little bit of a extended neck, which is not going to promote that neutral spine that we want to have during these squatting exercises, because if you don't have a neutral spine, you might recruit like muscles you're not necessarily trying to work. This is a lower body multi-joint exercise, so you really don't want to be straining at the neck in any way. And then I think just keeping a strong core, engaging your abdominals as well through the movement is gonna keep you from being too arched in your back, because when we're too arched in our back, some muscles might be lengthened like beyond what they should be, and that's how you cause like lower back injuries if you don't have a good strong core throughout that movement. And especially when you're lifting heavy weight, it's not just about having the back. So keeping a good strong core is going to give you the slight posterior pelvic tilt during that movement, but also keeping your lower back engaged. We don't want to be hunchback. We want to have an equal flexor and extensor moment right there at that lumbar spine. Overall, like he looks good. He looks strong coming up into the movement. Just maybe keep a neutral head, but still gaze forward and not be so like that, because then you're gonna get into passive insufficiency and active insufficiency up and down the anterior and posterior chain. If you're too flexed here, you might not even be able to get down into that movement as well as if you just kept a neutral spine. So these are all things to consider, and it's really just about what feels best for your patient while also making sure that they are performing it correctly.